Hello, thank you so much for having me. I still can't believe I'm here telling my story. But what happened to me is I always like to tell everybody that I am the face of socialized medicine because I lived it, I breathed it, and I survived it. But the only reason why I survived it is because I had to come to this country. What happened to me, very briefly, is I started to get all sorts of odd symptoms, but the most devastating one to me was I started to go blind. And started to lose my vision. And by the time they had tested my vision, I had lost half my vision in one eye and three-quarters of my vision in my other eye. And I called my optometrist, who is one of those doctors that is currently not under control of the government, so I didn't have to wait for any wait times to see him. And he ran some tests, and he knew right away what was wrong with me. He recommended that I see somebody immediately, and again, I felt very fortunate because I have a family doctor. And the same proportion of Canadians don't have access to a family doctor as Americans that don't have access to health insurance. And so I thought, okay, when I learned this, I was very appreciative of the fact that I am one of these people that actually have a family doctor. When she reviewed the tests that we did already have, we then needed to have an MRI done, and I needed to see two specialists. When she started making those calls for me, we realized that it was going to be 19 weeks for me to get an MRI, and it was going to be 4 and 6 months for me just to get in the door to see a specialist. Now, when people hear about wait times in Canada, a lot of people don't realize is that wait for you doesn't even start until you're actually in your specialist's office. So it was months that I was looking at. I have a lot of dear American friends that I had a conversation with, and they said to me, this is crazy, just go see another doctor. But in Canada, we can't do that. Once you're in a lineup, that's the lineup you're in, and you can't try to see somebody else. Now, this is the most embarrassing part of my story. I had grown up my entire life hearing about how horrendous the American healthcare system was. But I was so desperate, I was even willing to try the American system. Boy, did I eat my words after learning that. Came down to the United States for diagnostic testing and to see a couple of specialists. And again, very embarrassed about how I felt, but when I walked through the door, two of my doctors were Canadian doctors. They too had fled the system and were just able to do their job here in another country. Sat down, I was diagnosed within a week. My husband was called in, and we were quite confident at that point because we had a diagnosis in hand. And that's half the battle when you're struggling with some sort of serious condition. Anyways, my husband said, well, no problem. We have an appointment for September. So at least now we know what's wrong. And that doctor put down his pen and he said, unfortunately, your wife won't be here in September. So we knew that we were in trouble. Those Canadian doctors said, please don't panic. We are both from the area. We still have tons of connections. And in the back of my mind, I had still believed all the stories that if you're sick enough, you can get in. And now I was sick enough. I had the paperwork to prove it. And they made every phone call on my behalf. And again, they were unable to get me treatment. Again, the stubbornness in me decided that no, I was a professional problem solver by trade. I could speak for myself, and I knew what was wrong with me, and of course I would be able to get treatment back in Canada. So my husband and I packed everything up, and we head back home, only to find every single door closed. There was no way that I was moving any of this process any quicker. So within a couple of weeks, I returned to the United States and had my surgery. And at that point, I decided that I had gone through the system so many times and so many doors closed that I realized how serious our government-run healthcare had become. And I vowed at that point that I would talk to any Canadian and any American that would listen to me. All the years before, when Americans would find out I was Canadian, they would say, oh my goodness, you're Canadian. Are you ever lucky you have free healthcare? And now I have an answer, because you guys are so lucky that you don't have free health care. So that's what happened to me. And my biggest concern is I'm really not just a nosy neighbor that's sticking my nose in where it doesn't belong. What I am is I'm a very grateful neighbor because I had a place to run to. And I'm quite honestly, I'm afraid that if this bill stays as it is, I don't know where Canadians will flood to for their treatment. And worse than that, I really don't know where Americans will go. And I'm a little embarrassed because, you don't see the reverse of Americans running to Canada for treatment. So I'm here to tell my story and to tell everybody that I'm an average Canadian. And when you hear that Canadians aren't losing their homes, they're not going through bankruptcy just to pay healthcare bills, it's not true. I am just an average citizen. I had to put a second mortgage on my house, and my husband works 2 full-time jobs. We're really not sure when the bills will be paid. But when you're so sick and you are desperate, you will do anything you can to get treatment for your family. Thank you.